Okay, so moving on to when you're finishing a rotation. Okay, let me give an example, which is something I need to mention here. If you start a rotation in August, for example, you're going to have it's a 6 month rotation, so you're going to rotate in February. So the mistake people make is that they feel the 18 entries they need to have will span between August and January. It's more often not like that. Most times you will have your clinical supervisors review sometime in December or in January, because you need to move. You're moving in February, first week of February. So most times you may be having your clinical supervisor review sometime in December. Because remember, you need to have your CSR, then you need to have your ESR, which is your educational supervisors review, before your portfolio changes. So most times you don't have 6 months for your requirements. You have about 4 months or 5. So you have to keep that in mind, because before February, which is usually the first Wednesday in February, you need to have your CSR done, you need to have your ESR done, you need to have moved to the next review period. So I always tell anyone I speak to that just take it that you have 4 months plus to get everything done in your portfolio. That would help you keep on top of your portfolio. So towards the end, you will proactively approach your clinical supervisor for a CSR. So what I used to do is, because most times if you meet your clinical supervisor, if it's a hospital, they might delay in getting your CSR done. So what I used to do proactively is that I would contact my ES and say, this rotation is ending. When do you want to have an ESR? An interim ESR, because you have an interim ESR every 6 months. And then my ES would give me a date. So most times I would now go to this is being cheeky, but I would now go to my CS and say, my ESR is on this date, because my clinical supervisor knows that he has to get my CSR done before the ESR. So I'll say, I've talked with my ES, it's on this date. So when can we have CSR? So most times, if you have a CS that you need to push for things, once they see that you fixed your ESR, they are more inclined to do your CSR. So your CSR, you do it. Most times your CS can do it with your absence. So most times they can put it themselves, or you can request, or they can do it themselves. So if you're in primary care, so they are the ones that will click it in, and they just fill it in. So the main thing they are filling in is how you have performed in that rotation. That is it. So they'll fill that in. Once they've done and they've signed off, you can now have your interim ESR. That interim ESR in your first 6 months is just to see how you are doing, to tell you things you've not done, so that when you are when you are getting to your 1 year mark, you're not missing out on things like your mandatory training and things like that. So the interim ESR is serious, but the more serious one is your final ESR. So by the time you enter the second 6 months of your full year, you do the same thing, you get all your entries done, you have your CSR, and then you have your ESR. So all these, you need to fix them in, because like December, you might be having a problem where your CS is going on holiday, your ES is going on holiday. July, August, you might be having situations where they're going on holiday. So you need to proactively fix dates for these things, because it might shock you that if you approach your ES, let's use final 1 year. Let's say you're approaching the end of 1 year. You might approach your ES in June, that when do you want to have your ESR? And your ES says, oh, can we have it middle of May, because I'm on holiday throughout June. It happens. And then you now look at your portfolio and see that you don't have anything in your portfolio. So that's why you need to get on top of it early, because you don't know. For example, I had my final ARCP a couple of weeks ago, but I had my final ESR about a month before that, because my education supervisor was going on holiday. So you can imagine if everything was not put together, it would have been, some form of irresponsibility on my part. So have that in mind and plan everything ahead. So the last thing, so that's it about that. But the last thing is, when you want to prepare for your ESR, so you can see the portfolio here. So when you book your ESR meeting, you have some things you need to do. So you click on prepare. You have not even some things to do. You have quite a number of things to do before the meeting. So There are lots of things. You will complete your clinical experience coverage. So all this, you just complete. As you see the statements here, you complete it and save. So you have to respond to all this. Complete your clinical experience coverage, complete your educational assessment progress. So you open it. So you complete, you have to attest here that you have done everything. You have to click on all this. So in summary, having your ESR is not just booking the meeting. You have to complete this, complete everything here. Is when you have done all this and you save, that you now send to your ES. Your ES now goes through it. All this is done before your meeting. I hope that makes sense, but I know that you will have a demo in your course. So you do that to prepare for your ESR, and then everything is fine. Now, your clinical supervisor, especially in primary care, which is in the GP practice, has a lot to say about your performance. So their CSR report is very important. Their report and your ES report is what your panel looks at and will decide whether you can progress in training or not. So it's something you need to be on top of from the day one of your training so that you will not run into problems. And I'm sure you will hear a lot more on this in your course to know what to do, how to get on top of your portfolio from the get-go, and how to avoid any problems that will give you issues with your CSR report or your ESR reports. And I think that will be all for the portfolio.